I'm here with Dr. Marisha Agana, candidate for Congress in Ohio's 13th District. Dr. Agana, welcome. Let me ask you about why you're running for U.S. Congress. Well,
I've been a community advocate for underserved children. And ever since I became a part of the Ohio Foundation of the American Academy of Pediatrics and was trying to forge for projects that would benefit children, and I tried to turn to our local as well as congressional elected officials for help. Okay, I had the experience of being turned down or not listened to. So I was one time having a little bit of a, talk with a couple of friends, medical colleagues, who told me that I should consider running for public office. Well, mainly because I'm very passionate about my concerns for children, and plus I do have some political blood in me. I come from a family of politicians back in the Philippines. So I said, okay, well, are you folks going to support me? And they said, absolutely. So here I am.
What makes you a better choice to serve the people in District 13 than your opponent, Congressman Tim Ryan?
Well, first of all, I'm part of the community. I live, breathe, and practice medicine. I have solo practice of 4,000 patients that I serve on a day-to-day basis. I'm in the trenches. So in that way, even though I don't have political experience, okay, I have community immersion. And for me, that is a very big, strong advantage over my political opponent.
What's one of the biggest problems in Washington, D.C., and how would you go about fixing it?
Well, one of the biggest problems is the fact that elected officials have become complacent. A lot of them have left their communities and they have started residency in and around Washington, D.C. So they have lost touch with the people. And I would like to change things. I want to continue the practice of medicine along with serving my constituents.
How would you work with other members of U.S. Congress in Washington to create jobs and also increase the declining tax revenues here in Ohio and also across the country?
Well, first of all, I'd like to make it clear, by myself, I cannot do the job alone. I would like to go into Congress thinking that I can find citizen legislators who have like-minded principles and convictions that I have. So I will find those people, and I will try to, shall we say, immerse myself in intellectual discussion with my constituents and try to find out where I can basically help, okay, propagate the environment to create jobs. The government does not create jobs unless they're public, jobs. But for the private sector, which is what this country needs, it needs elected officials who will fight to repeal some of the regulations and policies that have restricted, the growth of economic, corporations in this country. I also am a very good supporter of simplifying our tax structure, and I believe in flat taxes, both corporate and personal.
And Doctor, what should Congress do, if anything, to help keep the cost of health care down for American families and, of course, here in Ohio?
Well, first of all, we need to repeal Obamacare. Obamacare is a tax. We already know that because the Supreme Court made a ruling and upheld it as a tax law. So we need to repeal Obamacare and replace it with patient-focused, directed health care reform. We also have to take care of the Medicare and Medicaid fraud that's existing in our healthcare system right now, which is costing $60 billion every year that it is not attended to. We also have to do very good comprehensive tort liability reform. So those things are what I would like to pursue when I get there as a citizen legislator.
Well, Doctor, we appreciate Dr. Marisha Agana running for Congress in Ohio's 13th District. Thank you very much.
Well, thank you for this opportunity.
You bet. Thank you very much.